My name is Deborah Garnick, and I'm pleased to speak with you today about what is a randomized controlled trial. I'm a professor at the Heller School at Brandeis University. Oftentimes, researchers want to investigate whether a new approach to clinical treatment is better than what's been used for years and years, and they'd like to prove that. If they just do that by looking at how are patients doing before the treatment, how are they doing after the treatment, they don't know from that approach whether or not the new treatment is any better than the existing treatments that are ongoing. So they might turn to a research design called a randomized controlled trial. If you're asked to be in such a trial, you will randomly, that is by chance, be assigned to either be in the control group or the experimental group. The control group generally gets what is accepted as a reasonable, safe, and effective treatment. The experimental group gets something that is new, that's being investigated. And then the researchers look to see before and after which has the better outcomes, which has the most improvement, which has the greater acceptance by patients. That way, we can tell in a very rigorous way without the influence of other things that are happening in the world that could have a different impact on the experimental and the control groups. It's a way of really understanding what the truth is in terms of looking at different approaches to treatment. It's widely used both in behavioral health, it's used in clinical medicine, it's used very, very broadly and is considered the gold standard. So I hope this brief discussion has helped you to better understand what is a randomized controlled trial. If you're ever asked to be in one, do consider it, and of course the investigators will give you a much longer and fuller explanation of what it's all about.